The top stories tonight in Y News. A new British study suggests that the B.1.1.7 variant found in the United Kingdom could be up to 100% deadlier compared with previously circulating forms of COVID-19.
An expert warns that increasing COVID-19 transmission in the Philippines may lead to virus mutations.
The Philippines records 3,749 new COVID-19 cases today, with the number of currently ill patients reach 47,000. A team from the Philippine Food and Drug Administration will visit the Gamaleya Institute manufacturing facility in Russia next week.
The Philippine National Police tells families of the 9 persons killed during the Calabarzon raids to file charges against the police officers.
And Thailand launches a yacht quarantine program for tourists. Good evening, Philippines and the world. Today is Thursday, March 11, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. A pivotal study by British researchers has shown that the B.1.1.7 variant is associated with a significantly higher mortality rate amongst adults diagnosed in the community compared to previously circulating variants. Marvy Delfin will give us the details live. Yes, Marvy?
Harleen, epidemiologists from the universities of Exeter and Bristol warn that while death in the community from COVID-19 is a rare event, the B.1.1.7 variant raises the risk to a worrying degree. The research sample of people infected with the B.1.1.7 variant were between 32 and 104% more likely to die from the virus than those infected with alternate variants. The peer-reviewed article published in the British Medical Journal revealed that the B.1.1.7 variant led to 227 deaths within 28 days of a positive result in a sample of almost 55,000 COVID-19 patients, compared with 141 among the same number of patients infected with other variants. Scientists also suggest that with 23 mutations in its genetic code, the B.1.1.7 variant is approximately 40 to 70% more transmissible, which complements previous preliminary evidence. Initial findings from the study were presented to the UK government earlier this year, along with other research by its expert panel, the New and Emerging Respiratory Virus Threats Advisory Group, or NERVTAG. Leon Danon, senior author of the study, emphasizes that as SARS-CoV-2 appears able to mutate quickly, there is a real concern that other variants will arise with resistance to rapidly rolled out vaccines. However, more research is needed to determine whether similar findings would emerge among more patients in all age groups from other parts of the world. Other factors would need to be considered, as mortality is also affected by how many patients require intensive care in hospital setting and staff shortage, which strains the quality of care. The B.1.1.7 variant has fueled the recent surge of infections across UK, which prompted a third national lockdown. The variant, found in more than 100 countries worldwide, is also fast spreading in the United States, and health officials warn it might become dominant in the country. Harleen?
All right, Marvy, thank you for that live report. Following the increasing transmission of COVID-19 in the Philippines, an expert warns that this may lead to having yet another variant or virus mutations. Marvin Calas explains why.
An increased possibility of having a new COVID-19 variant is likely to happen following the alarming transmission recorded in the country, just like the new variants discovered around the world. Although studies claim that earlier COVID-19 vaccines are still effective, the new variants are more contagious because of its increased transmissibility.
Ang virus po, ganyan po ang kanilang pamumuhay. Habang dumadami sila, pwede sila magkaroon ng mga mutation or kung tawagin po natin ay typo errors. Kaya ito po ay upang sila ay mag-survive at maging mas malakas. So habang lumalaki po ang bilang ng mga kaso ng COVID in different parts of the world, nabibigyan po ng pagkakataon ang virus na magbago. Ang bawat taong mahahawahan ay pagkakataon para sa SARS-CoV-2 virus na muling likhain ang kanyang sarili.
The Genome Center is eyeing the E484K, also known as the escape mutation of coronavirus, due to its ability to become undetected by an individual's immune system. Dr. Eva Marie Cochonco de la Paz, the executive director of the UP Genome Center, says that these variants of concerns are not dominant in the country. She added that they are also considering the possibility of having the Brazilian variant in the country, as studies suggest that it has a 40% increased transmissibility.
Hindi po natin maaaring i-disregard ang posibilidad na yan. Pero sa ngayon po, sa araw na ito, kasi po, tuloy-tuloy po ang ating pag-genomic surveillance at pagsisequence ng mga samples po ng mga virus galing sa samples ng mga pasyente sa different parts of the Philippines. Subalit sa ngayon po, wala pa. Hindi po natin, wala pa pong pumapasok na Brazil P.1 variant.
Dr. De La Paz, however, clarifies that only a lineage or a family of P.1 variant was discovered on their findings, but it is far different from the actual Brazilian variant. Meanwhile, the director reminds the public to continuously abide on the implementation of health protocols to help lower the increasing cases in the country. Marvin Calas, UNTV, News and Rescue. We serve the people, we give glory to God.
The Philippines logged 3,749 additional COVID-19 cases, bringing the country's total to 607,048. The DOH said that 7.9% of the cumulative tally, or 4069, are active cases, as shown in the latest case bulletin. Of these cases, 91.6% have mild symptoms, 4.4% are asymptomatic, 1.6% are in critical condition, 1.6% are in severe condition, and 0.77% have moderate symptoms. Meanwhile, 63 fatalities were also recorded, taking the death toll to 12,608. Also, 406 patients recovered, bringing the total number of recoveries to 546,671. The case bulletin also stated that currently 55% of the intensive care units dedicated for COVID-19 are available, while 63% of the isolation beds for coronavirus cases are unoccupied. In other news, police units are deployed in Navotas City to enforce public health guidelines amid the rising cases of COVID-19. Meanwhile, several health facilities in the city has now reached full capacity. Ray Pelayo reports why.
Teams from the Philippine National Police strictly enforce the minimum health protocols in Navotas City, especially in public places like markets. The NCRPO sent an additional 100 personnel to augment its workforce. Some residents were apprehended for not wearing face mask and shield, and those who bring minors. Violators were first warned, but some were already fined.
Pag sa mga adult po, meron po tayong curfew po na hanggang alas 10 po. Tapos sa minor po, 24 hours po ang fire po.
Mayor Toby Chanco said that last month, Navotas has the lowest active cases with 30 individuals. But now, they have more than 500 COVID-19 cases, and the city hospital have exceeded the capacity to care for COVID-19 cases.
Full capacity na po yung Navotas City Hospital sa kanilang COVID ward, no? At yung ating mga isolation facilities, full capacity na rin. Kaya doon na tayo nagdadala sa mga national isolation facilities.
Mayor Tiangco noted that the virus transmission is now within the family members. This is the main reason why cases balloon.
Isang tao na hawaan, yung buong pamilya niya, di times 7, times 8 yung kaagad ang bilang, di ba po? So kaya ang bilis tumaas ng kaso. Ay ganun din, pag lumabas itong mga taon to sa labas ng bahay at hindi nag-ingat, makakahawa naman sila.
Mayor Tiangco asked the cooperation of the residents to at least bring back the cases to the lowest number. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
Despite of the continuous increase of COVID-19 cases in the country, the Private Hospital Association of the Philippines says that the occupancy rate in most private hospitals is still manageable. Janice Inhente will tell us why.
Private hospitals also feel the surge of COVID-19 cases in the country, particularly here in the National Capital Region, Calabarzon, and Central Visayas. According to the Private Hospital Association of the Philippines, although COVID-19 admissions have increased, they are not yet at the critical level so far.
For the past siguro 3 days po, tumaas naman around 15% po compared to the last few days. Pero still within manageable levels pa po. Ibig sabihin, it's parang ang occupancy rate is around 40 to 50% lang po ng mga COVID beds. Kung critical level, ibig sabihin nun, mga 85% na po ng bed capacity ay na-occupy and more than 85%.
Some areas in the National Capital Region and Central Visayas are also seeing an increase in admissions of COVID-19 cases. According to DOH Secretary Francisco Duque III, the utilization rate in NCR hospitals is in the safe zone or even lower.
Thankfully, I think for NCR, it is still at safe zone. 45% ng NCR hospital care utilization rate or HCUR.
However, the government still ensured that private and public hospitals are ready in the event of a new surge. The authorities continue to remind the public that even though there are vaccines, the minimum health protocols must still be followed. Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
The tourism sector will remain open despite the increasing number of COVID-19 cases in the country. Janice Inhente reports why.
The Department of Tourism will not close the tourism sector amid the rising number of COVID-19 infections in the country. According to Secretary Bernadette Romulo Puyat, as long as the minimum public health and safety protocols are strictly followed, the operation of open tours will be able to continue. But Puyat cleared that the last decision will still be in the local government units.
As long as health and safety protocols are in place, we can restart tourism. As I said, pagka MGCQ, pwede na ang tourism. Pwede na magbukas. But whether to open up or not is up to the local government unit.
Some travel destinations have announced that they will reopen this March with negative swab testing requirements. These are Boracay, Bohol, El Nido, Coron, Palawan, San Vicente, Puerto Princesa, Ilocos Sur, Ilocos Norte, Pangasinan, La Union, Siargao, Siquijor, Dumaguete, Negros Oriental, Iloilo, and Cebu City. Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
For those watching us on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. The Philippine National Police told families of the 9 persons killed during police operations in Calabarzon to file charges against the police officers in connection with their claims that the operations were illegal. Leah Ilagan will tell us why.
PNP spokesperson Police Brigadier General Ildebrandi Osana maintained that the March 7 operations in Calabarzon were legitimate. Osana challenged the families of the 9 persons killed in the operation to file cases against the police amid their claims of summary execution. Rizal Provincial Director Police Colonel Joseph Arguelles also encouraged the family to file cases.
Hindi natin pinipigilan yung karapatan nila bilang mga mamayan ng Pilipinas na kung merong pag-aabuso ng ating mga operatiba, ng ating mga kapulisan, maaari silang mag-isampa ng walang kaso dapat sa atin.
Initial reports showed that policemen conducted the raids by virtue of search warrants for illegal possession of firearms and explosives. The PNP IAS is now conducting a motu proprio investigation on the so-called bloody operation, but the rights group Karapatan is not convinced on its investigation.
Una ko sa lahat, kapag ganitong mga insidente o kaso ng mga extrajudicial killing, totoo lang, ang lagi-lagi po namin panawagan, there should be an independent body who will investigate these cases. Ngayon, kung PNP rin po mag-iimbestiga sa kapwa nila PNP, without the result will be, kung magiging credible ang magiging resulta ng investigation.
Secretary Lorenzana appeals to the militant group to await the result of the investigation conducted by the NBI before seeking the help of the United Nations Human Rights Council.
So ang ginagawa nito sa kabila ng kalaban natin ay they are trying to preempt the investigation and paint us to be in the wrong or na nagkamali tayo. Hindi mara naman ako kung sino yung mga nagkamali dyan ay mapaparusahan, either they are PNP or they are armed forces.
At least 6 died in Rizal, 2 in Batangas, and 1 in Cavite following simultaneous police operations on Sunday. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
Malacanang appeals to the European Union delegation in the Philippines to let the government investigate the alleged human rights violation following the death of 9 activists during police and military raids in Calabarzon. Joanne Nano tells us why.
As part of the Philippine government's duty and commitment to investigate and punish those who are violating the laws, Malacanang is asking the delegation of the European Union in the country to give the government the chance to investigate the killings of 9 activists in Calabarzon last Sunday night. The EU earlier stated that they are very much concerned on the alleged excessive use of force against unarmed individuals and irregularities on the conduct of police and military operations. Presidential spokesperson reassures that there is no impunity under the Duterte administration and perpetrators will be punished once they are proven guilty over a case.
Mismo ang Pangulo ang nagsabi na sa marami okasyon na anuman paglabag sa operasyon ay aaksyonan. Sa UN Human Rights Commissioner for Human Rights at iba pang human rights groups, walang lugar ang impunity sa administrasyong Duterte. So I ask the European Union, please give the Philippines a chance to discharge its obligation to investigate, punish, and prosecute those who may have breached our domestic laws.
Malacanang said that the Department of Justice will be conducting thorough investigation over the so-called Bloody Sunday and vows to be fair on the probe. Secretary Roque again reiterates that there is no harassment of activists under the Duterte administration.
Ang obligasyon po ng Estado ay mag-imbestiga at magparusa ng mga lumalabag sa karapatang pantao. At yan naman po ang pangako ng ating Department of Justice, mabilis ang investigasyon at kung kinakailangan pagsasampa ng kaso laban po sa lahat ng mga lumabag sa ating batas.
Meanwhile, the presidential spokesperson also said that he will coordinate with the military over the alleged blocking of the release of the remains of the 4 activists, claiming that the government is halting them to conduct another autopsy. Several lawyers who are assisting the victims' camp believes that this is because of the alleged cover-up on evidences, providing that there was really an irregularity on the conduct of police operations. Joanaro, UNTV News and Rescue. We serve the people, we give glory to God.
Amid the spate of killings in the country allegedly involving some members of the police, a lawmaker is proposing the establishment of police courts in every province for speedy resolution of cases. Arlene Delgado will tell us why.
The Senate Committee on Justice and Human Rights resumed its hearing on the series of killings happening in the country. Its chairperson, Senator Richard Gordon, lamented the slow resolution of cases where some members of the police are involved. Gordon noted the police have no right to become judge, jury, and executioner all at once.
You are not exempt from facing charges just because you wear a uniform and a badge. Nakakahiya ang ginagawa ng ilang mga taong uniformado. How can you look at your children at night when you go home and some of your members are not good law-abiding citizens? Kahit na sino pang masamang tao, drug pusher, kahit na sa harapan ng West Barilin yung tao, kung hindi binigyan ng due process, you are guilty.
That is why the senator is pushing for his bill, seeking for the creation of police courts in every province in the country. According to the PNP, over 1,800 heinous and sensational crimes were recorded in 2020, which remain unsolved or so-called cold cases, ranging from murder, rape, kidnapping, robbery, among others. The PNP Criminal Investigation and Detection Group says they conduct case monitoring in every case they file in court. Police Major General Marnie Marcos, who heads the PNP Directorate for Investigation and Detective Management, says PNP Chief General de Bolsinas has ordered the investigation of cops who failed to testify or attend to court hearings.
There are some who were given penalties, Your Honor, demoted. Some were given suspension, and others, I'm not sure of the data if they were dismissed, Your Honor, because this is only a grave offense, Your Honor.
The Integrated Bar of the Philippines supports the proposed measure, noting that cases in specialized courts move much faster. However, the Philippine Bar Association suggests to do a thorough analysis on the proposal for its potential issues in the judicial system.
So there should be a very, very close analysis on how your proposed court would somehow relate with other existing courts like the Sandigan Bayan and the other, because there might be potential issues on jurisdiction.
Gordon then explained that the bill will give the appellate police courts the exclusive jurisdiction only on cases decided by the police courts. The bill also proposes for the Supreme Court to conduct training for the presiding judge and court personnel of the police courts about police protocols and operational procedures. Joaquin Delgado, UNTV News and Rescue. We serve the people, we give glory to God. The National Bureau of Investigation is expected to file a different complaint tomorrow in connection with Christine Decetta's death. Dante Amento reports live. Yes, Dante?
Yes, Arlene, National Bureau of Investigation or NBI spokesperson Ferdinand Lavin assures that they have evidence to file a case in connection to the death of flight attendant Christine Decetta. The NBI Death Investigation Division is expected to go to the Department of Justice or DOJ tomorrow. Lavin has earlier pronounced that by the second week of January, the NBI had acted on the case investigation 80%. Lavin adds the case he is pertaining to is different and will not affect the first rape with homicide case filed by the Philippine National Police.
Kung hindi naman ito yung nakafile sa kagaya ng nakafile sa Makati na rape with homicide, ito ay hindi naman for consolidation or para i-join yung issues. Kung magpa-file kami ng ibang kaso, ibang treatment nito.
But Lavin refuses to disclose the specific complaint as well as the respondents.
Hanggat hindi ito na ipa-file, we maintain the level of confidentiality in so far as the full result of the investigation is concerned. Out of respect to DID,
Even Justice Secretary Minardo Guevara also doesn't want to preempt the NBI's action. For now, Harleen, both the respondents and the complainant, Christine Decera's mother, Sharon, have not given any statement on the NBI's filing of a different complaint tomorrow. Back to you, Harleen.
Thank you, Dante Amento, for those updates on the Christine Decetta case. The Department of Public Works and Highways, or DPWH, is set to open the Alabang-Sucat Skyway northbound extension by the second quarter of 2021. DPWH Secretary Mark Villar said the 3.9-kilometer Sucat-Alabang Skyway extension project can provide convenient travel to motorists. Once the Skyway extension is completed, Villar said motorists heading to Cavite, Laguna, and other parts of southern Luzon will soon have faster trips. The Alabang-Sucat Skyway is part of the 3-lane Skyway extension that connects the elevated Skyway to South Luzon Expressway, or SLEX, through the Alabang Viaduct.
For those watching us on YouTube, please click the subscribe button you see on the right side of your screen and ring the bell for notifications. You may also follow us on Facebook. A team from the Philippine Food and Drug Administration is visiting Gamaleya Institute's manufacturing facility in Russia next week, which has applied for an emergency use authorization for its COVID-19 vaccine, Sputnik 5. Meanwhile, the FDA has not yet received any EUAE request from COVID-19 vaccine developer Sinopharm. Michael Miguel explains why.
The Gamaleya Research Institute submitted their emergency use authorization application in the country last January 7, but still is pending for approval by the Food and Drug Administration. According to Food and Drug Administration Director General Eric Domingo, Gamaleya still has to submit a certificate of good manufacturing practice. The pharmaceutical firm decided to invite Philippine FDA officials to conduct an inspection in their manufacturing facility in Russia.
So ang inspection kasi usually titignan mo yung findings, tapos may sabihin mo sila kung ano silang kailangan i-correct or kailangan i-explain nila sa amin kung ano ang measures nila to make sure na yung mga findings namin ay ma-address.
According to DG Domingo, Philippine-trained FDA regulatory inspectors will travel next week to Russia. Once Gamaleya's requirements are complete, it is possible that by March, FDA will grant them EUA in the country.
Gusto naman natin matapos na within the month of March kasi pupunta sila, ang plano namin pupunta sila ng March 15 to 18, no? And then gagawa pa rin naman ng report yun. It might take a few days after that.
Another pending EUA application in the country is from Bharat Biotech of India that recently submitted their Phase 3 clinical trial results to FDA. Meanwhile, DG Domingo states that Sinopharm has only sent a letter of intent online through their local distributor. This, according to DG Domingo, is not an official EUA application. FDA has sent a letter to Sinopharm with the list of the requirements needed for an EUA application. But until now, according to DG Domingo, Sinopharm has not responded and sent their EUA application requirements.
So far, wala naman silang sinasubmit. So, as of this time, hindi siya talaga officially an application dahil wala pa silang na-file na any requirements.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, 2 barangays in Manila City have been placed under lockdown. Violators of this anti-COVID measure will be brought to a quarantine facility. JP Nunez reports why live. Yes, JP, good evening. Go ahead.
William, barangay lockdown violators in Manila City have been found to be not included in the list of APOR or authorized persons outside residence. As of this afternoon, authorities in Barangay 351 Manila have apprehended 9 violators. Those residents were brought to the Tondo Quarantine Facility.
Sila po ay magkakaroon ng 14 days of quarantine doon. Yan po yung binanggit ni Yorme dun sa magiging proseso pag nakaano po ng violators.
Lahat po ng lalabas na hindi
kasali sa mga pinapayagan, ay lalagay po namin kayo sa aming quarantine facility ng 14 days. Kasi you are exposing others sa danger.
There are 12 COVID-19 cases so far in Barangay 351, which put them on lockdown to last for 4 days or until 11:59 p.m. of March 14, Sunday. With the lockdown in place, residents who are not authorized outside their homes or those with no essential activities outdoors are expected to stay at home. The local government assures supply of food boxes during the lockdown, which took effect today. Back to you, William.
Thank you, JP Nunez, reporting live.
The Department of the Interior and Local Government, or DILG, will issue a memorandum circular to local governments nationwide, reiterating the removal of local travel documentary requirements before entry of people in their localities. Meanwhile, the agency will ask Congress for additional funds under the Bayanihan 3 to extend the contracts of contact tracers. Aiko Miguel explains why.
Several local government units are still not easing their requirements for domestic travelers. The DILG would reiterate the resolution number 101 of the COVID-19 task force that scrapped the requirement of travel authority from the police and medical clearance from the local health office.
Kasi nga may napansin tayo na may mga LGUs hanggang ngayon na hindi pa rin sumusunod dun sa IATF resolution. Hinaantay nila yung implementing rules and regulations. So, itong implementing rules and regulations na ito, this is a product of consultations with the League of Cities, League of Provinces, League of Municipalities.
Interior Undersecretary Jonathan Malaya said local chief executives will be made to answer for their actions for failure to comply.
Once the MC is released, and hindi pa rin mag-comply ang mga LGUs, and there may be some, then mapipilitan na po ang DILG to issue a show cause order against them. And hopefully, once that is done, they will immediately comply para hindi na po mauwi sa pag-file ng kaso ng DILG.
Travelers just need to check with their LGU if RT-PCR is required, but LGUs have to take note that they can only require RT-PCR tests and not antigen or rapid tests. Meanwhile, authorities are strengthening contact tracing efforts because of the prominent rise of COVID-19 cases. Undersecretary Malaya reports there are 255,854 contact tracers nationwide, which are more than enough. They are composed of 29,611 contact tracing teams from local health offices, PNP, BFP, DILG, and volunteer organizations. According to DILG, 15,000 of them are hired by DILG, with their contract expiring on June, and it will request additional funds from Congress to extend the contracts of contact tracers until the end of the year.
Sapat po ang numero ng ating mga contact tracers sa buong bansa. Yung contact tracers na DILG hired for this year, ang pinagkunan namin ng pondo niyan ay yung naiwan na pondo from Bayanihan to recover as one act, and then yung 500 million coming from the 2021 DILG budget in the General Appropriations Act. So more or less more than 1 billion. We will request from Congress this appropriation para makasiguro tayo na we will have these 15,000 contact tracers until the end of the year.
Undersecretary Malaya explains contact tracing within 24 hours is essential to cut the transmission of COVID-19 infection in the country. They have deployed additional 100 contact tracers in Pasay City, 20 contact tracers in Navotas, and other areas with high cases to augment to the contact tracing efforts of LGUs. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
And for the news abroad, a lobbyist will be paid $2 million for explaining real situation in Myanmar following a coup. RK Lorca will give us the details live. Yes, RK, good evening.
Mariel, an Israeli-Canadian lobbyist, Ari Ben Menashe, will assist in explaining the army's movement in Myanmar to the United States and other countries, as well as to international bodies like the United Nations on the country's real situation. Ben Menashe and his Montreal-based firm Dickens and Madsen will represent Myanmar's military government in Washington on devising and execution of policies for the beneficial development of the Republic of the Union of Myanmar, according to the consultancy agreement submitted on Monday to the United States Justice Department. Ben Menashe told Reuters his task was to convince Washington that Myanmar's generals wanted to move closer to the West and away from China, and that they wanted to resettle Rohingya Muslims who fled a 2017 military assault for which the United Nations has accused the generals of overseeing a genocide. The said agreement has drawn attention to some experts, including John Sifton, Asia Advocacy Director at Human Rights Watch, on which he said that it is highly implausible that Ben Menashe could convince the United States of the narratives he's proposing. However, since Mya Tung-ngo and other top generals have been sanctioned by the U.S. Treasury Department and the Canadian government, the agreement says the payment will be made when legally permissible. Currently, Mariel, there are more than 60 protesters have been killed in Myanmar and 1,900 people have been arrested and still detained since February 1, including the state councillor Aung San Suu Kyi on the said military coup. Mariel?
All right, RK, thank you for that live report. Meanwhile, Brazil broke its record for new daily COVID-19 deaths with over 2,000 fatalities as the pandemic overwhelms hospitals and vaccinations progress slowly. Early Briones reports why live. Yes, Early, please go ahead.
Yes, Marielle. Brazil reported on Wednesday a record high daily COVID-19 deaths at 2,286 in 24 hours, bringing the national toll to 270,656. Brazil broke its own record for daily COVID-19 deaths the second day in a row, after 1,972 related deaths were reported on Tuesday. Brazil's leading public healthcare center, Fiocruz, warned that recent figures of the country's largest healthcare facility point to an impending collapse due to the immense pressure the relentless infection surges are bringing. Around 15 state capitals with intensive care units, including Rio de Janeiro and Sao Paulo, are now at 90% capacity, while Brasilia, Porto Alegre, and Campo Grande have now exceeded their capacities. Margaret Del Colmo, a doctor at Fiocruz, told AFP that the country is now at the worst moment of the pandemic and that 2021 will not be any easier compared to last year. Health authorities strongly suggest that the rate of transmissions of the infection is made worse by different, more contagious variants. At the same time, other experts warn that the country is now likened to a breeding ground of new variants of the virus, specifically a highly contagious variant from the Amazon city of Manaus, also known as P1, now under investigation if it is responsible for the sudden infection surges. Global authorities now call for emergency vaccination, lockdown, and social distancing protocols to prevent the P1 variant from spreading globally as early as possible. The country's president, Jair Bolsonaro, has reportedly downplayed the threats the virus has brought to the country, with many citizens reporting that they feel abandoned by the federal government. So far, Mariel, Brazil has ordered more than 200 million doses of AstraZeneca, Oxford, and CoronaVac vaccines, but only 8 million people, or just 4% of the population, have had their first dose. Mariel?
All right, Early, thank you for that live report. Meanwhile, the House of Representatives gave final approval to one of the largest economic stimulus measures in U.S. history. This report will tell us why.
A massive $1.9 trillion pandemic relief bill, now on its way to President Joe Biden's desk, will deliver cash to a wide array of groups. The U.S. House of Representatives today approved final passage of the bill, which Biden is expected to sign on Friday on a 220 to 211 party line vote. The final bill includes one-off direct payments worth $1,400 to be sent off to most Americans and extends weekly jobless benefit payments of $300 until September. It also allocates $350 billion to state and local governments, some $130 billion to school reopening, $49 billion for expanded COVID-19 testing and research, as well as $14 billion for vaccine distribution. The liberal-leaning Urban Institute estimated that the legislation would reduce the number of people that live in poverty in America from 44 million down to 28 million. Mariel Latoza, UNTV, News and Rescue. We serve the people, we give glory to God.
Thailand will be allowing visitors to spend their time on board a yacht or small cruise ship for their mandatory quarantine. Ia Decetta reports why.
The government of Thailand is hoping to revive the country's struggling tourism industry with this new initiative, which is expected to bring 1.8 million baht or $58 million in yacht tourism revenue. The yacht program, which was announced on Monday, will allow tourists with a negative coronavirus test to spend their 2-week quarantine on a yacht in Phuket. A trial run is already underway, with around 100 yachts expected to participate. Travelers will be required to wear a smart wristband that can track the wearer's location via GPS and monitors vital signs like temperature and blood pressure. The government further states that the device can transmit information within a 10-kilometer radius, even at sea. Since the pandemic started, the number of tourists in Phuket plummeted from 40,000 to 50,000 a day to only hundreds. The country has only been reopening its borders since October last year after banning foreign tourists in March. Thailand's tourism minister announced last week that he would also propose a plan for tourists to undertake mandatory quarantine in popular tourist spots like beach resorts in famous provinces like Phuket, Krabi, and Chiang Mai. Ia Decetta, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news in other parts of the globe. I am Mariel Latoza, live from Perth, Australia. Good evening.
Meanwhile, Philippine National Police Chief Police General Debold Sinas has tested positive for COVID-19. In a statement, Sinas said that his COVID-19 RT-PCR swab test results came out on this morning. But before that, all his swab tests were negative. According to the PNP chief, he is still asymptomatic. Sinas asked the people who might have come in direct contact with him to have themselves tested too and observe themselves for possible infection. While recuperating, Lieutenant General Guillermo Algazar, the PNP's Deputy Chief for Administration, would be the officer in charge. And those are the reasons behind the news, March 11, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.